any tests that I have to have done, and ensure that I get them done at no cost to me. So that's another good thing because I don't have any medical coverage.
Oh, okay.
And that really does help a lot.
Okay. Okay.
So,
wow.
Excuse me.
This is a very wonderful health center here.
It is. Because it really helped me a lot.
And I'm glad.
I have been really sick at sometimes. And didn't know where to go except to come here. And they're taking care of me. And I appreciate that.
You've got a person who's worked at GM for 20 years, always had premium health insurance, always had a car, always had a home. And now all of a sudden, there's no more GM job. They've lost their car, they've lost their home. They did not lose their diabetes diagnosis, so they still need to see a doctor. So when we get them, sometimes they're expecting a ghetto, dirty clinic, because when they say free clinic or a clinic for underinsured or uninsured, they expect it to be something shabby, they expect it to be treated badly, and we go out of our way to let them know that no, you're just as important to us as the person with the premium insurance that you were before. You're still that important person.
At one point, I was under a private doctor, okay? And when my insurances, were terminated because I got sick, and I wasn't able to work anymore, then your job only holds your insurance for a certain time period. And once my doctor found out, I was under a private physician, I no longer had medical insurances. He told me he was going to refer me to this particular clinic. So that's when I was introduced to Advantage. And when I got here, I liked it. I liked the physicians that I was under. They were kind and they were sensitive to my, physical needs, and everything went well with them.
I found out that I was having seizures, and I didn't want to believe it. My girlfriend started telling me I'm waking up. When I go to work, I was wondering why my tongue was all chewed up. I didn't understand. But I didn't want to tell her because I didn't believe it. So she finally told me we need to go, do some further things and check you out thoroughly. I have come here, and I mean every person that I have run into, hands off to, professional at the highest level. They have been really good to me, and they've helped me find a lot of resources, and keep myself in check as far as my health goes. And I think I've got some valuable information that I share it with some of my friends, whatever, it's got like high cholesterol or whatever may be ailing them. I talked to them, I'm like, look, man, we're in the same boat. A lot of us, we just don't have insurance. So if we can find a place like this, you can still get taken care of. That's my story from coming to Advantage.
So when I heard about this clinic, they go by your income. I came here and have been able to get my blood pressure under check, by coming here to this clinic. And I'm sure there's a lot of people before even the Healthcare Act has gone into effect, that were in Detroit, just like I am, sort of that fall between the crack. You don't have a full-time job, you got a part-time job, and there's no health insurance involved, and you just can't afford to go out and get health insurance if you got to pay your rent, pay, put gas in your car. It sort of falls to the wayside.
So what do you think about this location?
I love it. This is my first time. I hadn't been here since last year was over at the other place. This is the first time coming to this place since you moved, and it's beautiful. I've just seen a little bit of it so far because I just walked in today, and it's clean, airy. It doesn't
feel like you know how you go to some doctor's office, you get that smell or that feel. It feels like, it doesn't feel that way. It feels light and airy and friendly and inviting. The receptionists all had beautiful smiles on their face this morning. I felt good coming in here.
Primarily, my role is to ensure that the clinic runs as smoothly as possible. So that includes making sure the front desk, the appointments are scheduled, that they are checking and confirming appointments, and making sure the providers, they're not overbooked. That the walk-in appointments are scheduled accordingly, according to the providers that we have available. Making sure that everything else, as far as the infrastructure, the heating,
just everything.
My name is Monique Stanton. I'm the president and CEO at Care of Southeastern Michigan. We're a nonprofit organization that's based in Macomb County, and we've been working with Advantage Health Centers to form a partnership so the families that we serve have access to high quality and affordable health care, and the families at Advantage Health Services have access to services and programs that we offer. I think one of the most impressive things about the facility is that sometimes, unfortunately, there is a perception that when you're going to something that's a federally qualified health center or a facility that may be serving a lower income population, or there sometimes is an expectation that the services are less than what other individuals get. When you come into this facility, it's a beautiful facility, it's clean, it looks exactly like any other. Actually, it looks better than most other healthcare facilities with the art, the murals. It's a very welcoming environment, and I think it's very impressive that they're committed to having a high quality and a beautiful environment for the people that they're serving.
You need something that looks good or sounds good or encouraging to feel good. Sometimes when they told us about the mural being on the front wall, I think that's awesome because the patients need to come in. Sometimes when you're not feeling well, you can see one bright color, it'll make you feel just a little bit better, like sitting out there waiting.
The inspiration comes from telling the story about the community center Advantage and how it helps people, its community and its client. Like I said, help uplift their spirits, give them encouragement, whatever they're going through. I know this center is a tremendous asset to the community, and their mission is to help people who, in certain points in their life, feel like they, don't have that much help. The healthcare industry is very challenging for a lot of Americans and stuff. So, I just want to, I want my piece to, inspire people. And I know that there is a center that can help you.
I think art helps beautify the community, and art helps make places a welcoming place for individuals. Art can also be reflective of the people being served in a community. And so for a health organization to have art, it really promotes a welcoming environment. I think reduces maybe that anxiety and anxiousness people may be feeling when having to go to the doctor or talk about serious health issues and needs by really creating a welcoming environment.
I think art helps with the healing process because it gives you a visual of what could be. So while the circumstances may be gloomy, maybe pretty dark, but art is always, you can make it how you want it to be. You can be optimistic, it can be inspirational. You can just pretty much paint the picture. So art is, you have a blank canvas and it takes the focus away from reality and it gives you a new reality or a new set of hope.
When you put pictures on the wall and the average person come in, they see a picture, it's just a picture. But if that picture have a story, then that person don't only see a picture, it sees a story. And if that story has some type of weight where it relates to you, now you are part of the story. And when you become a part of anything, then it has worth.